The crystal chandeliers cast geometric shadows across the marble floor of St. Augustine Hospital's grand atrium. 200 guests in evening wear circulated beneath donor plaques etched in gold. The annual gala hummed with the particular frequency of wealth-meeting philanthropy. Champagne flutes clinking, laughter choreographed, everyone performing generosity. Maya Chen stood near the hors d'oeuvres table in a simple emerald green dress, the fabric modest against her brown skin. She'd come at Dr. Cross's insistence. "You belong here," Helena had said. Maya wasn't convinced. Victoria Ashford approached like a yacht cutting through still water. Ivory silk draped her thin frame. Diamonds caught light at her throat and wrists. Her heels clicked precise rhythms against stone. "That color is stunning on you," Victoria said, voice smooth as her champagne. "Are you with the fundraising committee?" Maya smiled. "No, I work here. In surgery." Victoria's eyebrows lifted. "Oh, which practice?" "I'm a surgical nurse." The temperature dropped 5 degrees. Victoria's smile calcified into something brittle and sharp. She glanced at Maya's dress again, recalculating value downward. "A nurse," Victoria repeated, as if tasting something bitter. "I thought you were someone important, someone who actually makes decisions." The conversations around them stuttered into silence. Heads turned. Maya felt 20 gazes lock onto her skin. "I make plenty of decisions," Maya said quietly. "Life and death ones, actually." Victoria laughed, a dismissive sound like breaking glass. "Of course you do, dear. Following doctor's orders must feel very decisive." She sipped her champagne. "It's just, you carry yourself with such confidence." "I assumed you were educated." The word hung in the air between them, sharp-edged and deliberate. Maya's smile never wavered, but something behind her eyes hardened into diamond. "I am educated, Mrs. Ashford. Perhaps more than you know." Victoria's lips curved. "Well, good for you." She turned away, dismissing Maya as easily as one dismisses a waiter after ordering. Maya stood very still, her champagne untouched. Across the room, Dr. Helena Cross met her eyes. The older surgeon's expression said everything. "Don't react, not here." Not now, but Maya's hands, steady as iron, remembered every patient she'd saved, every suture she'd placed, every crisis she'd navigated while doctors froze. She set down her glass and walked toward the exit, emerald dress swaying. Behind her, Victoria laughed with the hospital board president, already forgetting the encounter. Maya wouldn't forget. Maya Chen had learned to navigate dual worlds before she could drive. Daughter of a Chinese father and a black mother, she existed in the complicated space between expectations and assumptions. Her parents had immigrated with medical degrees that America refused to recognize. Her father drove a taxi. Her mother cleaned houses. Both insisted their daughter would heal people, as they'd been trained to do. She'd chosen nursing after her pre-med dreams collided with financial reality. Student loans felt like shackles. A nursing scholarship felt like oxygen. Her parents hid their disappointment poorly. "You have surgeon's hands," her mother said once, touching Maya's long fingers. "This world just won't let you use them properly." Maya proved her wrong quietly. Night classes, extra certifications, surgical first assist training completed in secret, paid for with double shifts and skipped meals. She learned to suture on pigskin in her apartment, studied vascular anatomy until she could map arteries with her eyes closed. Dr. Helena Cross, the only black surgeon on staff, noticed and became her unlikely mentor. "You're better than half my residents," Helena told her during a complex procedure, "but they'll always see the scrubs before they see the skill." Maya understood. At St. Augustine, hierarchy was religion. Doctors were priests, nurses were acolytes. The system ran on deference and degrees, not competence. She'd made peace with it, found purpose in the work itself, the way her hands knew exactly where to place the retractor, how to anticipate the surgeon's next move before they voiced it. In the OR, she was invisible and indispensable simultaneously. Her locker held 3 things: extra scrubs, a photo of her parents, and a certificate from the American Association of Surgical Assistants. She never showed anyone the certificate. Credentials meant nothing if people refused to see them. Victoria Ashford lived in a different universe entirely. Third-generation pharmaceutical wealth, hospital board member. Her name graced 2 wings and a research center. She collected charity galas the way some women collected handbags, each one another opportunity to feel important, necessary, good. She'd never worked a day requiring physical labor. Never felt the particular exhaustion of a 12-hour shift on bleeding feet. Her understanding of medicine began and ended with tax-deductible donations and doctor's appointments, where staff addressed her as Mrs. Ashford. Ma'am, she believed in meritocracy because she'd never experienced its absence. Believed in hierarchy because it placed her comfortably at the top. And she believed fundamentally that some people were born to serve while others were born to be served. The 2 women orbited the same hospital, but existed in parallel dimensions. Maya arrived through the staff entrance at dawn. Victoria arrived through the main lobby in town cars, usually for board meetings or fundraisers. Their paths should never have truly crossed. But fate, indifferent to social architecture, was already drawing them together. In 3 days, Victoria would need surgery. In 3 days, the careful separation between their worlds would collapse entirely. Neither woman knew it yet, but the countdown had already begun. Monday morning arrived with the clinical brightness particular to hospitals. Maya clocked in at 6:15, earlier than required but later than usual. The gala had stolen her sleep. Victoria's words echoed louder than they should. She pushed them down. Professionalism was armor. She'd learned to wear it well. The OR schedule posted on the break room board showed a routine Monday. 3 gallbladders, 2 appendectomies, 1 hernia repair. Maya was assigned to room 4 with Dr. Marcus Webb, the hospital's most senior general surgeon. He was technically competent and emotionally absent, Maya's preferred combination. At 7:30, Dr. Webb's patient arrived for pre-op. Maya checked the chart and felt her stomach drop. Patient, Victoria Ashford. Procedure, laparoscopic cholecystectomy. She stared at the name. Of all the surgeons, of all the days. Problem? Sarah Kim, another surgical nurse, appeared beside her. No, Maya said quickly, just surprised. She's on the board. Webb does all the VIP cases, Sarah shrugged. You good with this? I can switch if you want. Maya considered it. Considered letting someone else handle the woman who'd called her uneducated 3 nights prior. But something stubborn in her chest refused. I'm good, she said. She wasn't good, but she was professional. At 8 o'clock, Victoria arrived in pre-op wearing a hospital gown that somehow still looked expensive. Her hair was perfect. Her jewelry had been removed reluctantly. She looked smaller without her armor of silk and diamonds, but her entitlement remained intact. Maya entered to do the pre-surgical checklist. Victoria's eyes widened in recognition, then narrowed. You, Victoria said flatly. Mrs. Ashford. Maya kept her voice neutral. I'm Maya Chen. I'll be your surgical nurse today. No, Victoria's hand shot up. Absolutely not. I want someone else. Maya had expected this. Dr. Webb specifically requested me for your procedure. I'm his primary surgical nurse. It was true. Webb trusted Maya's hands more than any other nurse's. He'd never said it aloud, but his assignment spoke clearly. Victoria's jaw tightened. Then get me a different surgeon. Your surgery is scheduled for 10 o'clock. Rescheduling at this point would require, I don't care what it requires. Victoria's voice rose. I will not have someone uneducated touching me during surgery. The words landed like a slap. Maya's hand stilled on the clipboard. Around them, the pre-op area went quiet. 2 nurses pretended not to listen. An orderly froze mid-step. Maya met Victoria's eyes. I have over 7 years of surgical experience, Mrs. Ashford. My credentials are impeccable. You're in excellent hands, your credentials. Victoria laughed bitterly. You followed some instructions and got a certificate. That's not education. That's training. Like a dog. Something in Maya's chest turned to ice. Not anger. She'd learned to freeze anger before it showed. This was colder, clearer. I'll inform Dr. Webb of your concerns, Maya said quietly. He'll address them before the procedure. She turned and walked away before Victoria could respond. Behind her, she heard Victoria demanding the charge nurse. Demanding someone qualified. Demanding anyone else. Maya found Dr. Webb in the surgeon's lounge reviewing films. He looked up as she entered. Mrs. Ashford wants a different nurse, Maya said. Webb frowned. Why? Maya hesitated. How to explain bias without seeming sensitive. How to name racism without seeming accusatory. Personal conflict, she said finally. From the gala. Webb waved a hand dismissively. She'll be unconscious in 2 hours. Personal conflicts don't matter in the OR. He returned to his films. You're my best nurse, Chen. I need you in there. It should have felt validating. Instead, it felt like being caught between two forms of dismissal. Victoria's open contempt and Webb's casual blindness. Understood, Maya said. She returned to prep, where Victoria had escalated to the surgical coordinator. The coordinator, a tired woman named Patricia, was explaining that switching surgical teams mid-morning was impossible. Then delay the surgery, Victoria demanded. Mrs. Ashford, you've been NPO since midnight. Your imaging is scheduled. The OR is blocked. Dr. Webb's entire day would need restructuring. I don't care. Patricia saw Maya approaching, and relief flashed across her face. Nurse Chen is one of our most experienced surgical nurses. Dr. Webb specifically, I want someone else, Victoria repeated, voice hard as stone. Maya stopped 3 feet away. Mrs. Ashford, I understand your concerns, but I promise you'll receive exceptional care. My only priority is your safety. Victoria stared at her. For a moment something flickered in her expression. Discomfort, maybe, or recognition of how badly she was behaving. But pride won. Fine, Victoria bit out. But if anything goes wrong, I'm holding you personally responsible. Maya nodded once. Noted. She finished the pre-op checklist in silence. Victoria refused to make eye contact. The IV went in smoothly. Maya's hands never missed. Consent forms were signed with angry flourishes. At 9:45, the orderly came to transport Victoria to the OR. As the gurney rolled past, Victoria stared at the ceiling, jaw clenched. Maya walked behind carrying the chart. Inside, she felt nothing. She'd learned to feel nothing when people tried to make her small, but in her locker, that certificate waited. Those credentials Victoria dismissed as training. Maya had never needed validation before. She wouldn't start now. The surgery would speak for itself. The OR prep area smelled like antiseptic and determination. Maya scrubbed in with methodical precision, fingers spreading surgical soap across skin she'd trained to be steady. 2 minutes, elbows to fingertips, rinse and repeat. Through the window she could see Victoria already positioned on the table, anesthesia team working, Dr. Webb reviewing the surgical plan, everything proceeding normally as if the past hour of confrontation had never occurred. That was the gift and curse of the OR. Once the patient went under, personality dissolved. Consciousness erased conflict. Victoria would sleep through her own contempt. Maya finished scrubbing and backed through the door, hands raised. A tech helped her into the sterile gown. Gloves snapped on, transforming her hands into instruments. You good? Sarah asked quietly. She was circulating today, managing supplies outside the sterile field. Always, Maya said. It wasn't true, but it would become true the moment she stepped to that table. That was the discipline, the ability to set aside everything human and become purely functional. Her feelings didn't matter. Victoria's feelings didn't matter. Only the work mattered. She approached the OR table. Dr. Webb stood across from her, already gloved. The surgical tech arranged instruments with practiced efficiency. Anesthesia called out vitals from behind the drape separating Victoria's head from the surgical field. Maya looked down at Victoria's exposed abdomen, prepped and painted orange with betadine. The skin looked vulnerable, soft, human in a way Victoria's words had refused to be. For one brief moment, Maya felt the weight of the entire morning. The gala, the dismissal, the word uneducated hanging in the air like a stain. Her mother's voice whispered in her memory, "Prove them wrong with excellence, not anger." She'd been proving people wrong her entire life. Teachers who expected less, professors who seemed surprised by her test scores, patients who requested white nurses, then thanked her profusely when she saved their IVs from blowing. The accumulated weight of low expectations pressed against her shoulders constantly. But her mother's other words came back stronger. "You have surgeon's hands, Maya. Never forget what they can do." Maya looked at her gloved hands hovering above the surgical field, steady, capable, carrying knowledge most doctors didn't realize she possessed. Victoria didn't know about the surgical first assist certification, didn't know about the advanced vascular training Maya completed on her own time, didn't know that Maya had seen complications Dr. Webb had never encountered, studied procedures he'd never needed to learn. She didn't know because people rarely looked past the title. Nurse meant subordinate, nurse meant less than. The actual skill became invisible beneath the label. Maya inhaled slowly through her surgical mask. The anger she'd frozen in pre-op thawed just enough to fuel her focus. Not rage. Rage was useless here, but determination sharp as a scalpel. Today she would be flawless, not to prove anything to Victoria, who wouldn't remember, but to prove it to herself, that the hands Victoria called uneducated could hold a life with more care than most doctors managed. That competence existed independent of recognition. That dignity wasn't something people gave you. It was something you carried, regardless of who tried to take it away. "Ready?" Dr. Webb asked. Maya positioned herself across from him, hands ready. To retract, to suction, to anticipate his every need before he voiced it. "Ready," she said. The surgery began. The first incision was smooth. Dr. Webb's hands moved with the confidence of 1,500 similar procedures. Maya fell into rhythm immediately, retracting tissue, suctioning blood, maintaining the clear field he needed to work. This was her favorite part of the job, the silent choreography. The way experienced teams moved like one organism, each person knowing their role so completely that communication became unnecessary. But as Webb dissected toward the gallbladder, Maya's mind drifted to another OR. Another surgery, the one that changed everything. 2 years ago, Dr. Helena Cross's operating room, a ruptured appendix in a teenager. Maya had been observing, technically off-duty but hungry to learn. Helena had encouraged it. "Watch everything," she'd said. "Surgeons aren't born. They're built by repetition and attention." The surgery should have been routine, but the appendix had adhered to the small bowel, complicating the dissection. Helena worked carefully, explaining each step to the resident assisting her. Maya watched from the corner, absorbing every movement. Then the teenager's blood pressure dropped. Anesthesia called out numbers. Helena's hands moved faster, searching for the source. A small bowel injury, torn during adhesion dissection. Blood filled the field. The resident froze. Helena barked orders, but the young doctor's hands shook, missing the bleeder twice. 20 seconds felt like 20 minutes. The teenager was bleeding out. "Maya," Helena said sharply. "Step in." Maya had stared. "I'm not." "Step in now." Maya scrubbed and gloved faster than she'd ever moved. At the table, Helena guided her hands to the injury. "Feel that? The tear is here. You need to oversew it with running 3-0 silk," Maya finished. Her hands were already moving. needle driving through tissue with precision she'd practiced on simulation models for months. The repair took 90 seconds. The bleeding stopped. Vitals stabilized. Afterward, in the locker room, Helena sat beside her. "You have the hands," she said quietly. "You have the knowledge, but you don't have the degree, and in this system, that's all that matters." "So what do I do?" Maya asked. Helena looked at her for a long moment. "You keep learning. You get certified as a surgical assistant. You position yourself so that when the moment comes, when someone's life depends on skill instead of credentials, you're ready. And if that moment never comes—" "It will," Helena said, "because medicine is chaos dressed as order. Emergencies don't care about hierarchy. And when they happen, the people who know what to do are the ones who matter, title or no title." Maya had taken Helena's advice. Spent 18 months completing surgical first assist certification, learned advanced suturing techniques, studied vascular anatomy until she could draw every branch of the hepatic artery from memory. She never told anyone except Helena. The II knowledge felt like a secret weapon, powerful only if kept concealed until needed. Her parents didn't understand why she worked so hard for a nursing career. They'd hoped she'd return to medical school eventually, become the doctor they'd been prevented from being. But Maya had made peace with her path. She wasn't less than a surgeon. She was something different, someone who understood the work from every angle, who could navigate the space between nursing and surgery with unique fluency, someone who, in the right crisis, could do what doctors couldn't. "Retraction, Dr. Au," Webb said, pulling Maya back to the present. She adjusted the retractor, exposing the cystic duct. Webb isolated it carefully, applying clips. Standard procedure, everything progressing normally. But Maya's eyes tracked something else. The imaging she'd reviewed earlier had shown a vascular variant, a small aberrant artery near the surgical site, common enough but requiring care during dissection. She'd mentioned it to Webb during the surgical briefing. He'd nodded dismissively. "Seen hundreds of these," he'd said. "Imaging always makes things look worse than they are." Now, watching his dissection approach that area, Maya felt a cold finger of unease trace down her spine. The aberrant artery wasn't visible yet. But it would be. In the next 5 minutes, when Webb freed the gallbladder from surrounding tissue, she opened her mouth to remind him. Closed it. He was the surgeon. She was the nurse. The hierarchy was clear, but Helena's voice echoed. "When someone's life depends on skill instead of credentials, you're ready." "Dr. Webb," Maya said carefully. "The imaging showed a variant artery in this region. Just wanted to confirm you've noted it." Webb didn't look up. "I've got it, Chen. Trust the process." He continued dissecting. Maya watched his movements, calculating distances, tracking the angle of approach. Something felt wrong. His trajectory was too aggressive for the anatomy she'd memorized from the scans. "Doctor," she said again, more firmly, "I really think we should—" "Chen." Webb's voice hardened. "I appreciate your vigilance, but I don't need a nurse teaching me anatomy." The words struck like a physical blow. Not because they were cruel. Webb wasn't cruel, just dismissive. But because they revealed the fundamental truth. Her knowledge meant nothing if he refused to hear it. Maya fell silent, held the retractor, watched, and prayed she was wrong. The gallbladder came free from the liver bed without issue. Dr. Webb worked efficiently, clipping and dividing the cystic duct and artery. Maya's unease persisted, but the procedure continued smoothly. Maybe Webb was right. Maybe the imaging had exaggerated the variant anatomy. "Almost done," Webb announced. His voice carried satisfaction. "Easiest VIP case I've had in months. Should be closed in 20 minutes. He began to remove the gallbladder through the small laparoscopic incision. Maya managed suction, keeping the field clear. Everything looked textbook perfect. Then Webb reached for the final adhesion, a thin band of tissue connecting the gallbladder to the peritoneum. Maya saw it happen in slow motion. The cautery tool activated. The adhesion separated. And beneath it, hidden until this exact moment, a small aberrant branch of the hepatic artery tore open. Blood filled the field instantly. "Damn it," Webb muttered. "Small bleeder." "Suction, Chen," Maya suctioned, but the blood came too fast. What should have been a minor ooze was a pulsing stream. The variant artery wasn't small. It was larger than normal anatomy suggested, exactly as the imaging had shown. "Pressure," Webb ordered. Maya placed a gauze pad over the site. Blood soaked through in seconds. Webb's casual confidence evaporated. "That's not responding." "Get me a clip." "No, get me 2 clips." The surgical tech handed him instruments. Webb applied clips blindly through the blood, trying to catch the bleeder he couldn't see. The first missed. The second slipped off. Blood pressure dropped. BP 95/60, anesthesia called out. Heart rate climbing to 110. Webb's movements became hurried, imprecise. Maya saw his hands begin to shake. The subtle tremor that appeared when surgeons operated. Beyond their experience level, this was supposed to be routine. Routine cases didn't require crisis management. Webb was good at routine. But this wasn't routine anymore. "I need better visualization," Webb said, frustration bleeding into his voice. More suction. More light. Maya suctioned continuously, but the blood kept coming. The small laparoscopic field was now obscured. Webb tried 2 more clips. Both failed to secure the artery. "Convert to open," Maya said quietly. Webb ignored her. "1 more clip." "I almost had it. Doctor, we need to convert to open surgery. You need direct visualization and access." "I said I almost had it." But he didn't have it. And Victoria's blood pressure continued dropping. 85/50 now. The monitors beeped faster, more insistent. Maya's mind raced through options. This wasn't just a small arterial bleeder anymore. Based on the blood loss rate and location, Webb had torn a significant branch, possibly the right hepatic artery's anterior branch. Standard hemostatic techniques wouldn't work. He needed to expose the porta hepatis, get proximal control and repair the injury properly. But Webb didn't do complex hepatic surgery. His practice focused on routine general surgery. He wouldn't know the anatomy well enough to navigate a repair under pressure. Maya knew the anatomy, had studied it, could draw it from memory, but she was just a nurse. Webb attempted another blind clip. It slipped off immediately. "Blood pressure, 80/45, transfusion protocol," anesthesia announced. "We're losing her." The words hung in the air, sterile and devastating. Maya looked at Victoria's draped face beyond the surgical field, unconscious, unaware that her dismissive words from the gala now echoed with terrible irony. The uneducated nurse was watching her bleed out, while the educated surgeon's hands failed. No, Maya wouldn't let it happen this way. "Dr. Webb," she said, voice cutting through his panicked movements, "you need to expose the hepatoduodenal ligament and get proximal control of the hepatic artery before attempting repair." Webb's hands stilled. He stared at her across the table. "What did you say?" "The porta hepatis," Maya repeated louder now. "You're trying to control a branch injury without controlling the source. You need to—" "I know what the porta hepatis is," Webb snapped, but his eyes betrayed him. He didn't know how to access it under these conditions. Had probably never needed to in 15 years of routine surgery. "BP 75/40, anesthesia called. "She's crashing." Webb stood frozen. Maya saw the moment of terrible clarity pass through his expression, the recognition that he was out of his depth and sinking fast. The room held its breath. Monitors screaming, blood pooling, time compressing into a single impossible moment. Maya made her decision. "Let me show you," she said. Webb's eyes locked with Maya's across the blood-soaked surgical field. Pride and panic warred in his expression. Every second of hesitation pushed Victoria closer to the edge. "Show me," he repeated, voice tight. "You're a nurse." I'm a certified surgical first assistant with advanced vascular training, Maya said. And right now that patient has about 90 seconds before irreversible shock. The monitors agreed with shrieking urgency. BP 72/38, heart rate 125 and climbing. She's decompensating, anesthesia warned. We need intervention now or we're calling a code. Webb looked at Maya, at the bleeding, at his own trembling hands. The calculation was brutal and fast. Talk me through it, he said finally. Maya's training took over. Convert to open. Midline incision. We need to pack the liver and get into the porta hepatis. Webb grabbed the scalpel. His hand shook slightly, but he made the incision, a quick vertical line through Victoria's abdomen. Maya's hands moved simultaneously, retracting tissue, anticipating each step. Lap pads, Maya called. The tech slapped them into Webb's hand. He packed the liver, applying pressure to slow the bleeding while exposing the deeper anatomy. The blood slowed but didn't stop. Maya could see the torn vessel now, exactly where the imaging had predicted. The anterior branch of the right hepatic artery, lacerated and retracting into tissue. I need to isolate the hepatic artery, Webb said, but his hands hovered uncertainly over the anatomy. The porta hepatis was a tangle of critical structures, arteries, veins, bile ducts all compressed into a small space. One wrong move could be catastrophic. Maya's voice stayed calm. Mobilize the duodenum first. Coker maneuver. That'll give you access. Webb performed the maneuver, but his dissection was tentative. Precious seconds ticked away. BP 70/35, anesthesia announced. I'm running vasopressors, but she's not responding. We need that bleeding stopped. Webb's forehead glistened with sweat. I can't see the artery. There's too much. It's there, Maya interrupted. Medial to the bile duct. You're looking at it, you just can't recognize it through the hematoma. Then you do it, Webb said suddenly. The room went silent. Even the monitor seemed to pause. What? Maya's voice cracked for the first time. Your hands are steadier. You know this anatomy better than I do right now. Webb stepped back slightly. If you're certified as a first assist. Save her. It wasn't permission. It was capitulation born of desperation. But it was enough. Maya's hands entered the surgical field with purpose she'd suppressed her entire career. Her fingers explored the anatomy with tactile precision, feeling what eyes couldn't see through blood and swelling. There, the hepatic artery, pulsing weakly beneath her fingertips. Vascular clamp, she said. The tech handed it over. Maya placed it with absolute certainty, occluding the artery proximal to the injury. The bleeding stopped. BP stabilizing, anesthesia called. 78/42, she's responding. Maya didn't celebrate. Stopping the bleeding was step one. Now came the repair, exposing the torn vessel and reconstructing it without causing further damage. Her hands moved like they'd been waiting years for this moment, because they had. She dissected carefully through the hematoma, exposing the lacerated artery. A clean tear, maybe 4 millimeters long. Repairable, but requiring microscopic precision. I need 6-neoprolene on a vascular needle, Maya said. Webb watched as Maya sutured the artery with movements too precise to be anything but expert. Each stitch placed exactly. Each knot tied with controlled tension. This wasn't nursing. This was surgery. 5 minutes later, the repair was complete. Maya removed the vascular clamp slowly, watching for leaks. The artery held. No bleeding. The tissue pulsed with restored blood flow. BP 82/48, anesthesia announced. Climbing steadily. Maya stepped back, hands returning to their proper position. The moment of transgression ended. Hierarchy reasserted itself, but everyone in that room had seen what happened. A nurse had just performed a vascular repair that most general surgeons couldn't manage. Webb cleared his throat. Good work, Chen. I'll close. His voice carried something new. Not quite respect, but no longer dismissal. Maya nodded silently. Her hands were steady. Her heart was not. Victoria Ashford's life had been saved by the uneducated hands she'd mocked 72 hours earlier. The irony was almost beautiful. The surgery continued in heavy silence. Webb closed the abdomen with methodical care, his earlier confidence replaced by something subdued. Maya assisted without speaking, hands moving through familiar motions while her mind spun with implications. She'd crossed a line, stepped outside her scope of practice in a way that was technically legal. She was certified, but professionally dangerous. Nurses didn't perform arterial repairs, didn't take over surgeries, didn't make surgeons look incompetent in front of the entire OR staff, even if she'd saved a life. Victoria was wheeled to recovery 90 minutes later, stable, but requiring close monitoring. The blood transfusion continued. Vitals remained tenuous but improving. Maya stripped off her gloves in the changing area, hands finally beginning to shake with delayed adrenaline. Sarah appeared beside her, eyes wide. "That was incredible," Sarah whispered. "Where did you learn to do that?" "I didn't," Maya said quickly. "I just assisted Dr. Webb." Sarah's expression said she knew better, but she nodded. "Right, of course." The lie felt necessary. Self-preservation disguised as humility. Maya changed back into her scrubs and returned to her regular duties. 2 more surgeries that afternoon, both routine, both with surgeons who treated her as exactly what her badge said, surgical nurse. She didn't see Dr. Webb again that day, didn't see Victoria, but at 4 o'clock as she was restocking suture kits, her supervisor appeared, Margaret Torres, the perioperative director. Her expression was carefully neutral. "Maya, Dr. Webb wants to see you in his office." 5 o'clock, Maya's stomach dropped. "About the surgery?" "He didn't say, but—" Margaret hesitated. "Just be prepared." "Prepared for what?" "Gratitude? Reprimand? Termination?" Maya finished her shift in a haze of anxiety. At 4:55, she knocked on Webb's office door. "Come in." Dr. Webb sat behind a mahogany desk that cost more than Maya's annual salary. He gestured to a chair. Maya sat spine straight, hands folded. "That was remarkable work today," Webb began. "You saved that patient's life." Maya waited. There was a but coming. She could feel it, but it's raised some concerns. Webb leaned back. "You performed a vascular repair. That's outside standard nursing scope, even with your first assist certification." "You asked me to assist," Maya said carefully. "I know, and I'm grateful, but—" He rubbed his temple. "The surgical committee will need to review what happened. There will be questions about why I needed that level of assistance, about my competency with that case." Understanding dawned cold and clear. This wasn't about Maya's boundaries. It was about Webb's reputation. "What are you saying?" Maya asked. "I'm saying we need to be careful about how we document this." Webb's eyes wouldn't quite meet hers. "The official record should show that I performed the repair with your assistance." Standard first assist role. Nothing more. Maya's jaw tightened. "That's not what happened. It's what needs to have happened." Webb's voice hardened. "For both our sakes. If the truth comes out, you'll face disciplinary action for exceeding your scope. I'll face questions about my surgical competency. We both lose. So you want me to lie? I want you to be smart." Webb leaned forward. "You're a talented nurse, Maya. Don't throw away your career over one surgery. Take the win. The patient lived. That's what matters." Maya sat very still. The rational part of her brain understood his logic. The proud part rebelled against the erasure. "I need to think about it," she said finally. "Don't think too long. The surgical report is due tomorrow morning." Webb stood, signaling the meeting's end. "I hope you'll make the right choice." Maya left his office feeling hollowed out. She'd saved a life and was being asked to pretend she hadn't. The injustice of it burned like acid. She was walking toward the exit when she passed the recovery unit. Through the window she could see Victoria in bed 4, still unconscious from anesthesia. Monitors beeped steadily. Nurses moved around her with practiced efficiency. Victoria would wake in a few hours. Would be told everything went smoothly. Would thank Dr. Webb for his skilled hands. Would never know. Maya turned away and headed home, the weight of silence pressing against her chest. Behind her, in the recovery unit, Victoria's eyes fluttered open. Maya's apartment was dark when she entered at 7:30. She didn't turn on the lights. Just dropped her bag by the door and sat on the couch in the gathering shadows. Her phone buzzed 3 times. Sarah checking in, Helena requesting a call, her mother asking about dinner plans. Maya ignored them all. The silence felt appropriate, heavy and absolute. She'd spent her entire career navigating the space between competence and recognition, learning to find satisfaction in the work itself rather than acknowledgement. She'd made peace with invisibility because visibility often meant vulnerability. But today had been different. Today her hands had held a life with skill that most surgeons didn't possess. Today she'd proven every doubt wrong, every dismissal false, and now she was being asked to erase it. Maya looked at her hands in the dimness. They looked ordinary, small even. Nothing about them screamed exceptional. But they'd sutured a torn artery with precision that had taken years to develop. They'd navigated anatomy most nurses never touched. Her mother's voice echoed from memory. "You have surgeon's hands, Maya." Maybe. But the system only saw nurses' hands. And nurses' hands, no matter how skilled, weren't supposed to do what she'd done today. She thought about Webb's offer. Sign the report. Say she assisted in the traditional sense. Protect them both. Keep her job, her reputation, her carefully constructed career intact. It was the smart choice. The safe choice, the cowardly choice. Maya's phone buzzed again. This time she looked. Helena's name glowed on the screen. She answered. "I heard," Helena said without preamble. "The whole OR is talking about it." "Maya, that was extraordinary." "Webb wants me to bury it," Maya said flatly. Silence on the other end. "Then, of course he does. He's not wrong, though. If this gets reviewed, I could lose my license. Operating outside my scope, even in an emergency." "You saved a woman's life," Helena interrupted, while the surgeon froze. "That's not exceeding your scope. That's being the most qualified person in the room. The committee won't see it that way, maybe not, but I will." Helena's voice softened. "I know what you're thinking, Maya. That it's easier to disappear. To let Webb take the credit and move on. You've been doing that your whole career." Maya said nothing, because it was true. "But this is different," Helena continued. "This woman dismissed you as uneducated, tried to have you removed from her surgery, and then you saved her life with skills she didn't believe you had. That means something." "It means I'm good at my job," Maya said bitterly. "Nothing more. It means you're better than the system that tries to limit you." Helena paused. "What would your mother say?" Maya closed her eyes. Her mother, who'd watched America refuse to recognize her medical degree, who'd cleaned houses while holding knowledge that could have saved lives, who'd told Maya to be better, do better, prove them all wrong, but also who'd said the world will try to make you small. "Don't help them. She'd tell me to fight," Maya whispered. "Then fight," Helena said simply. "Not for recognition, not even for justice, but because the truth matters. Because excellence hidden is excellence wasted. Because somewhere another black nurse is watching to see what's possible." They talked for another 20 minutes. Helena didn't push, just listened as Maya worked through the implications, the risks, the potential costs. When they hung up, Maya sat in the dark for another hour. Then she opened her laptop and began typing her own version of the surgical report. Every detail, every moment. The truth complete and undeniable. She didn't know if she'd submit it. But writing it felt necessary. Felt like reclaiming something that had almost been stolen. Her phone buzzed one final time. A text from the hospital. "Victoria Ashford awake and responsive in recovery. Requesting to speak with surgical team." Maya stared at the message. Victoria was awake. Soon she'd be told what happened. Would be fed Webb's version of events. unless Maya spoke first. The cursor blinked on her laptop screen. The report waited unfinished. Dawn was hours away. Maya kept typing. Morning arrived with unusual clarity. Maya had slept 3 hours, but adrenaline compensated for exhaustion. She arrived at the hospital at 6, earlier than necessary, carrying a printed copy of her report in a manila envelope. Helena was waiting in the staff lounge. She looked at the envelope, then at Maya's face. "You're sure about this?" Helena asked. "No," Maya admitted, "but I'm doing it anyway." They reviewed the report together over terrible coffee. Maya had documented everything. Webb's initial dismissal of the imaging concerns, the arterial injury, his inability to manage the complication, and her step-by-step intervention. Clinical, factual, undeniable. "This will end his career," Helena said quietly. "It might end mine too," Maya countered. "Or it might change everything." Helena set down the report. "I'm submitting a supporting statement as the surgeon who trained you. I'll testify to your competency if this goes to review." Maya felt something loosen in her chest. "You'd do that?" "I've been waiting years for someone to challenge this system properly." Helena smiled. "Might as well be you." At 7:30, Maya requested a meeting with Dr. Patricia Nguyen, Chief of Surgery. The secretary said Dr. Nguyen was in meetings all morning. "It's urgent," Maya said. "Regarding yesterday's complication with Victoria Ashford." The secretary's expression shifted. "I'll see what I can do." 20 minutes later, Maya was shown into Dr. Nguyen's office. The chief of surgery was a small woman with steel-grey hair and a reputation for fairness that bordered on ruthlessness. "Nurse Chen," Dr. Nguyen said, gesturing to a chair. "I've already received Dr. Webb's surgical report." He indicated a minor complication that was successfully managed. "Are you here to dispute that?" Maya placed her envelope on the desk. "I'm here to provide a complete account." Dr. Nguyen opened the envelope and began reading. Her expression never changed, but she read the entire report twice. "These are serious allegations," she said finally. "They're documented facts," Maya replied. "The surgical recording will confirm everything." Dr. Nguyen's eyebrows rose. "You want me to review the OR video?" "I'm requesting a full surgical committee review of yesterday's case." Maya's voice stayed steady. "Not to blame Dr. Webb, but to ensure accurate documentation and appropriate follow-up." It was a careful dance. Maya wasn't attacking Webb directly. That would make her seem vindictive. She was requesting transparency, which was harder to argue against. Dr. Nguyen studied her for a long moment. "You understand this will likely result in disciplinary proceedings for both you and Dr. Webb?" "I understand. You could lose your position, I know. Then why?" Maya met her eyes. "Because the patient deserves to know who actually saved her life. Because the next complication might not have someone trained to handle it. And because I refuse to pretend I'm less capable than I am just to make someone else comfortable." Dr. Nguyen almost smiled. "Fair enough. I'll convene a committee review for Thursday. You'll both be asked to provide testimony." She paused. "For what it's worth, Nurse Chen, I've reviewed your record. You're one of our best. I hope this doesn't end that." "Thank you," Maya said. She left the office feeling simultaneously liberated and terrified. The machinery of institutional review was now in motion. No taking it back. Sarah caught her in the hallway. "Is it true? You're reporting Webb?" "I'm reporting what happened," Maya corrected. "There's a difference." He's furious. "Says you're trying to destroy him." "I'm trying to tell the truth." Sarah looked conflicted. "Some of the nurses think you're brave. Others think you're suicidal. Nurses don't challenge surgeons and survive here." "Maybe it's time that changed," Maya said. She spent the rest of the day working her regular shift, hyper-aware of whispers following her through corridors. Word had spread fast. The nurse who'd performed surgery, who'd challenged Dr. Webb, who might have just ended her own career. At 3 o'clock, Maya received a summons to the recovery unit. Victoria Ashford was awake, alert, and asking specifically for her. Maya's heart hammered as she approached room 4. This was the moment she'd been avoiding. The confrontation she'd saved Victoria's life to perhaps never have. But there was no avoiding it now. She pushed open the door. Victoria sat propped up in bed, looking pale but coherent. Her eyes tracked Maya's approach. "You," Victoria said. The word hung between them, heavy with history. "Mrs. Ashford," Maya replied. "How are you feeling?" "Like I was hit by a truck." Victoria's voice was hoarse. "Dr. Webb was here this morning. Said the surgery had complications, but he managed them successfully." Maya said nothing, waited. "But the nurses have been talking," Victoria continued, "saying things that don't match his version." Her eyes locked on Maya's. What actually happened in that operating room? This was it, the moment of choice. Maya could defer to Webb's report. Keep the peace, walk away clean, or she could tell the truth and face whatever came next. Maya looked at the woman who'd called her uneducated, who'd tried to have her removed, who'd bled out while Maya's hand saved her. "You had a vascular complication," Maya said quietly, "an arterial injury. Dr. Webb needed assistance beyond the standard scope. I provided that assistance. You're alive because of decisions made by the entire surgical team." It was the truth, carefully worded. Not quite confession, not quite deflection. Victoria stared at her for a long moment. "The nurses say you performed surgery, that you repaired an artery while Webb watched. The official report will be reviewed by the surgical committee," Maya said. "I can't discuss details until that process completes." Can't or won't? Both. Silence filled the room. Victoria's expression was unreadable, pain medication softening whatever emotions played beneath the surface. "I was cruel to you," Victoria said finally. "At the gala. I said things I shouldn't have." "Yes," Maya agreed. "No point in denying it. I don't remember the surgery, but I remember what I said before." Victoria's voice cracked slightly. "And now I'm hearing that the person I tried to have removed saved my life." Maya's throat tightened. She hadn't expected this. Hadn't prepared for Victoria's awareness for her vulnerability. "I did my job," Maya said. "Nothing more." "I think we both know that's not true." Victoria looked down at her hands. "I'm sorry. For what I said. For who I was." Maya nodded slowly. The apology felt genuine but also incomplete. Words couldn't erase bias, couldn't undo the systems that enabled it. But they were something. "A start. Rest," Maya said. "You still have a long recovery ahead." She turned to leave, but Victoria's voice stopped her. "Thank you," Victoria whispered, "for saving someone who didn't deserve it." Maya paused at the door. "Everyone deserves excellent care, Mrs. Ashford, even people who don't think I'm capable of providing it." She walked out before Victoria could respond. Behind her, in the hospital room, Victoria Ashford began to cry. Thursday arrived too quickly. The surgical committee convened at 2 o'clock in the hospital's main conference room. 8 committee members, including Dr. Nguyen, Dr. Webb, Helena, and 3 other department heads Maya didn't know well. Maya entered wearing her cleanest scrubs and the confidence she'd built over 7 years of proving herself. She sat at the end of the long table, hands folded, spine straight. "This review concerns the surgical case of Victoria Ashford. On Monday, May 5th, Dr. Nguyen began. Dr. Webb has submitted his operative report. Nurse Chen has submitted a conflicting account. We're here to determine what actually occurred and what, if any, protocol violations happened." Dr. Webb spoke first. His version matched his written report. Minor complication, standard management, successful resolution with appropriate assistance from surgical staff. Nurse Chen's assistance was valuable, Webb concluded, but suggestions that she performed surgery are exaggerated. She assisted within her scope as a certified first assist. When he finished, all eyes turned to Maya. She stood slowly. "May I request that we review the surgical recording before I provide my testimony?" Dr. Nguyen nodded. "Dr. Ross, please cue the video." The lights dimmed. The large monitor flickered to life, showing the OR from the overhead surgical camera. Timestamp 10:47 a.m. Victoria's abdomen already open, Dr. Webb working through the laparoscopic approach. Maya narrated quietly as the video played. Here at 10:52, the arterial injury occurs. You can see the blood filling the field. On screen, the moment played out exactly as Maya remembered. Webb's increasing panic. Failed attempts at hemostasis. Vitals declining. At 10:56, I advised Dr. Webb to convert to open and access the porta hepatis. He initially declined. The committee watched Webb's hands shake. Watched him attempt multiple failed interventions. At 10:59, with blood pressure at 70/35, Dr. Webb stepped back and asked me to take over the repair. On screen, the moment was undeniable. Webb literally stepping aside. Maya's hands entering the field, moving with precision and purpose. The room watched in absolute silence as Maya isolated the hepatic artery, placed the vascular clamp, and performed the repair. Every movement captured in high-definition clarity. When the video ended, no one spoke. Dr. Nguyen broke the silence. Dr. Webb, you stated in your report that you performed this repair with standard nursing assistance. The video clearly shows otherwise. Webb's face had gone pale. I was supervising, providing guidance. The video shows you standing motionless for 4 minutes while Nurse Chen performed a complex vascular repair independently. Dr. Nguyen's voice was ice. That's not supervision. That's abdication. I made a judgment call, Webb said defensively. In a crisis situation. She was qualified, and I believed her intervention gave the patient the best chance. Which means you recognized your own limitations in that moment, another committee member interrupted. Limitations you didn't disclose in your operative report. The interrogation continued. Webb tried to defend his choices, but the video undermined every claim. He'd frozen. Maya had saved the patient. The documentation had been deliberately misleading. Finally, Dr. Nguyen turned to Maya. Nurse Chen, you performed a surgical repair beyond standard nursing scope. Even with your first assist certification, arterial reconstruction is not within your practice boundaries. You must have known this. I did, Maya said quietly. So why did you do it? Maya looked at each committee member in turn. Because Dr. Webb was unable to perform the repair, and the patient was dying. I had the training and skill to save her life. In that moment, protocol seemed less important than outcome. That's not how medical practice works, Dr. Nguyen said. We have boundaries for reasons. Patient safety, legal liability, chain of responsibility. I understand, Maya replied. But if you're asking whether I'd make the same choice again, knowing a patient would die if I didn't, yes, I would. The room fell silent again. Maya could feel her career hanging by a thread. Helena spoke for the first time. May I add context? She didn't wait for permission. I trained Nurse Chen in advanced surgical techniques over 2 years. She has completed over 200 hours of simulation training, has certification in advanced vascular access, and has skills that exceed many of our junior residents. What happened Monday wasn't a nurse overstepping. It was the most qualified person in the room saving a life when the assigned surgeon couldn't. That's quite a claim, Dr. Cross, another committee member said. It's a documented fact. I have her training records, her certifications, and testimonials from 3 other surgeons who've worked with her. Helena slid a folder across the table. Maya Chen is extraordinary. The only reason we're calling this a violation instead of a miracle is because her title says nurse instead of doctor. Dr. Nguyen opened the folder, scanned the contents. Her expression remained neutral, but something shifted in her eyes. The committee needs time to deliberate, she announced. Dr. Webb, Nurse Chen, you're both dismissed. We'll notify you of our decision by end of business tomorrow. Maya stood. Webb refused to look at her as they left the conference room separately. In the hallway, Helena caught her arm. That was good. Really good. Was it enough? Maya asked. I don't know, Helena admitted. But you told the truth. That matters. Maya went home that evening with no idea if she'd still have a job in 24 hours. The uncertainty was almost worse than knowing, but she'd done what her mother always taught her. Proved them wrong with excellence. The rest was out of her hands. The call came at 4:30 Friday afternoon. Dr. Nguyen's office immediately. Maya's hands were steady as she walked through the hospital corridors one last time. Whatever happened next, she'd made her choice. No regrets. Dr. Nguyen sat behind her desk, expression unreadable. "Sit, please." Maya sat. "The committee has reached its decision." Dr. Nguyen folded her hands. "Dr. Webb is being placed on probationary status for 6 months. He'll be required to complete additional training in emergency vascular complications and will undergo peer supervision for all complex cases. His operative report has been amended to reflect accurate documentation." Maya's heart hammered. That was Webb's consequence. But what about hers? "As for you," Dr. Nguyen continued, "the committee acknowledges that you violated practice boundaries. However, we also acknowledge that you did so in a genuine emergency, with appropriate training and with a successful outcome. Additionally, your attempt to document the incident accurately, while Dr. Webb did not, weighs in your favor." Maya held her breath. "Therefore, we're issuing a formal reprimand to be placed in your file, standard procedure for any scope violation. But we're also creating a new position." Dr. Nguyen's lips curved slightly. "Advanced practice surgical nurse. It will require additional certification and oversight, but it will formally expand practice boundaries for qualified nurses who demonstrate exceptional skill. Dr. Cross has agreed to help design the program. You'll be the first candidate." Maya stared. What? "You exposed a gap in our system, Nurse Chen. We can either punish you for it or fix the system. We're choosing the latter." Dr. Nguyen stood, extending her hand. "Congratulations. And thank you for your integrity." Maya shook her hand, still processing. She wasn't fired, wasn't even demoted. She was being promoted, in a sense, given official recognition for skills she'd always possessed. "There's someone waiting to see you," Dr. Nguyen added. "Room 342. Maya walked to the room in a daze, pushed open the door. Victoria Ashford sat in the visitor's chair, dressed in street clothes, ready for discharge. She looked smaller than Maya remembered, more human. "They told me what happened," Victoria said without preamble. "The real version. What you did. What Webb tried to hide." Maya leaned against the doorframe. "You're being discharged?" "In an hour." Victoria stood carefully, still moving like someone healing from major surgery. "I wanted to see you first. To say..." She stopped, started again. "I spent my whole life believing I was important because of my money, my name, the institutions I supported, but you saved my life with your hands and your knowledge. Things I dismissed as unimportant, things I called uneducated. Mrs. Ashford, let me finish." Victoria's voice cracked. "I was wrong. Profoundly, shamefully wrong. Not just about you. About what matters. About who deserves respect." She pulled an envelope from her purse. "This is a donation to the hospital. $1 million. Designated specifically for nursing education and advancement programs. I'm also resigning from the board. Someone else should have that seat. Someone who actually understands what happens in these halls." Maya took the envelope with numb fingers. "You don't have to—" "I do," Victoria interrupted. "I can't undo what I said, but I can try to make sure fewer people like me get away with saying it." She held out her hand. "Thank you, Maya, for saving someone who didn't deserve your compassion." Maya looked at the offered hand, saw it trembling slightly, not with weakness but with genuine emotion. She shook it. "Everyone deserves excellent care, even people who need to learn why." Victoria nodded, tears brimming. "I'm learning, finally." After Victoria left, Maya stood in the empty room for several minutes. She thought about her mother, about Helena, about every person who'd ever doubted her capabilities because of her title or her skin or their own limited imagination. She thought about the hands that had sutured an artery while a surgeon watched. The hands Victoria had called uneducated, the hands that had proven worth through precision instead of proclamation. Her phone buzzed. "Her mother dinner tonight? I made your favorite." Maya smiled and typed back, "Yes, and Mom. I have something to tell you." She looked down at her hands one final time. Steady, capable, finally acknowledged. Surgeon's hands after all. 6 months later, Maya stood in the same hospital atrium where Victoria had dismissed her. But everything had changed. The Advanced Practice Surgical Nurse Program had graduated its first class of 5 nurses. Maya served as clinical director, teaching others the skills she'd fought to prove. Dr. Webb had completed his probation quietly, humbler than before. Helena had been promoted to Chief of Surgical Education, and Victoria Ashford's name was on a new plaque, not for a building, but for a scholarship fund supporting nurses from underrepresented backgrounds pursuing advanced certifications. Maya ran her fingers across the brass lettering. Funny how pride could be transformed into purpose, how shame could become service. Her mother stood beside her, finally visiting the hospital where her daughter worked. She looked at the plaque, then at Maya. "Your hands always knew," her mother said softly. "The world just needed time to catch up." Maya thought about that night she'd sat in darkness, deciding whether to tell the truth or stay safe. Thought about Victoria bleeding out while bias clouded judgment. Thought about every moment her competence had been invisible because people refused to see. The lesson wasn't about proving anyone wrong. It was about proving yourself right, knowing your worth even when systems denied it. It was about choosing integrity when silence would be easier. About using skill not for recognition, but because lives depended on it. Excellence doesn't require permission, Maya thought. It only requires courage. She looked around the atrium, at nurses and doctors moving past, each carrying their own battles against assumption and limitation. How many others were hiding skills, suppressing knowledge, making themselves small to fit within boxes others had built? The work wasn't finished. One program, one policy change, one transformed perspective couldn't undo centuries of systemic bias. But it was a start. A crack in the foundation where light could enter. Maya touched her badge, still reading surgical nurse, but now carrying weight beyond the title. She thought of Victoria's apology, Webb's humiliation, her own vindication. But mostly, she thought of the quiet moment when her hands had moved to save a life without asking permission. That moment was the truth. Everything else was just documentation. Dignity isn't given by those who have power, she told Victoria. It's taken by those who have skill. And sometimes, the greatest education happens on an operating table, where titles dissolve, where only competence matters, where hands prove what words never could. Maya smiled and walked toward the OR. There was work to do. Lives to save. Systems to change, one surgery at a time. Behind her, the plaque gleamed in afternoon light. A monument to transformation, written in brass and truth. The camera pulls back slowly, showing the vast atrium filled with people, each carrying their own invisible expertise. The frame holds on Maya's figure growing smaller, emerald scrubs moving with purpose toward the doors marked surgery. Then the screen fades to black, and in that darkness, a single truth remains. Excellence finds a way, always.